Kita mo itong doon ka babae eh?
Hindi ra sa ila, pre.
Ara lang ang gamay bago para hapos bukason.
Siyempre papitan na.
First, nagawang ba lalaki sa likod? Sige. Ay, unang ko, bakit ito malalim sa ngayon doon? Hala, oo, ito may kapili sa dasal ng jacket.
Eh, pre, kanto kanta?
Sige, pre.
Hala, pasik ng katuan. Oh, Gino, hindi na daan.
Sympathetic nervous system. Inside the body, the sympathetic nervous system will take place. In a fraction of a second, the brain recognizes the danger in front of them and classifies it as a threat. Immediately, the sympathetic nervous system is activated, and without any consciousness by the body, at all several body functions are all affected at once. First, heart rate is increased. Increased heart rate results in increase in oxygen and nutrients that reach the brain and muscles, preparing them for whatever danger we'll have to face. Next, liver releases glucose. The liver is stimulated to release glucose to the bloodstream, providing more energy that will be ready to power the muscles in case it is needed. Also, bronchioles are dilated. Bronchioles of the lungs are dilated to welcome more air into the lungs, which will increase oxygenation blood and keep up increased flow of blood into the lungs due to the increased heart rate. The pupils of the eyes dilate because the sympathetic nervous system often activates when people are surprised. Pupil dilation is the visual cue that we use to be surprised at people's faces. The adrenal glands secrete epinephrine and norepinephrine. The adrenal glands are a pair of hormone-producing glands on the kidneys to respond to stress. The epinephrine and norepinephrine secreted by the adrenal glands have the same base effects as the nerves of sympathetic nervous system by increasing heart rate, increasing bronchial dilation, and lastly, increasing glucose releases from the liver. In addition, NOR is also known to increase alertness. It may seem redundant that these hormones have the same action as sympathetic neurons. And also, digestion is inhibited. In the moment of truth, a person may need every lost touch they can muster. It makes it an ordeal, then they will have plenty of time to complete digestion to whatever he ate for breakfast. Lastly, bladder is relaxed. SNS is only activated in situations where the brain decides there is a reasonable chance of survival. In a situation like this, a person can lose bladder and bowel control. They will also go limp due to fright. After moments of stress or danger, the parasympathetic nervous system has begun. The body relaxes and you feel secure and at ease. The parasympathetic nervous system operates immediately when the threat is gone. Their bodies automatically relax, and their body function have already returned to normal. First, heart rate decreases. When the danger behind them feels the longer needs to increase blood supply to his muscle when the heart slows down and conserves energy. Next, liver produces bile. The liver stops releasing glucose into the blood. Instead, focuses in activity on producing bile and detox in substances. Next, bronchioles are constricted. The bronchioles in the lungs are constricted to allow less air into the lungs. Now that the heart rate is decreased, oxygen consumption in the muscles is lower, so the body doesn't need much oxygen. Also, the pupils constrict. The pupils of the eyes constrict back to a more normal size. Next, adrenal glands stop secreting epinephrine and norepinephrine. Now that the danger is past, it's time for the body to relax and recover. And these two hormones are counter-reproductive to resting and relaxation. Next, digestion is stimulated. It is secreted in response to the presence of food. Gastrin stimulates the secretion of gastric acid by the parietal cell of the stomach mucosa. an in vitro dynamic model of food digestion diagnosis, the Human Gastric Simulator or HGS, has been designed to reproduce the fluid mechanical conditions driving the disintegration and mixing of gastric contents during digestion. And lastly, bladder contracts. Since it is not appropriate time for the person to urinate, the bladder is at ease. Even though there are more important things to attend right now, I'll bet some of you are thinking, hold on, I thought people wet themselves when they got scared. So, it turns out that the sympathetic nervous system is only activated in situations where the brain decides there is a reasonable chance of survival. The parasympathetic nervous system begins the process of relaxing and calming the body so that it can recover from the heightened physical and metabolic activity.
Haben ko kitang batuan. Gani, habin ko kita gani. Kaluoy sang gingkawatan. Salamat sila kita hindi sila kawatan. Naguludan tulog sa banto. Gani, ako naman nakatabas mga awat pa kita. Tara, para nagdikado kiti.
In summary, there are two main divisions of the autonomic nervous system. The sympathetic prepares the body for intense physical activity and often referred to as the fight or flight response. The parasympathetic nervous system has almost the exact opposite effect and relaxes the body and inhibits or slows many high energy functions. It is pretty much a rest and digest response. When an immediate threat is present, the function of the sympathetic nervous system prepares the body for extreme physical activity and includes increased heart rate, glucose release from the liver, bronchial dilation, pupil dilation, secretion of epinephrine and norepinephrine from the adrenal glands, relaxation of the bladder, and inhibition of digestive activity. Once the threat is gone, the function of the parasympathetic nervous system promote relaxation, recovery of the body and include decreased heart rate, bile production in the liver, bronchial constriction, pupil constriction, inhibition of the adrenal gland, contraction of the bladder, and lastly, stimulation of the digestive activity.
Okay ka lang, miss? Tracy, by the way. Sige, mauna ko.